She's a loving wife and mother, also a former Georgia State trooper. But little did she know, in the fall of 1999, that God would have her to be chosen to conquer. Here's Colette Jenkins and Chosen to Conquer.
Welcome back to Chosen to Conquer, and I'm your host, Colette Jenkins. This week, we have a lot of information that we found that is pertinent to you getting directly from us. Well, today, I have one of my favorite people, and a lot of others, favorite physician, my primary physician from right here in Albany, Dr. Devell Young, from the Medical Associates. He's going to help us discuss some of the details that I'm sure you'd be interested in knowing. So I just want to welcome Dr. Young. Welcome.
Oh, thanks for having me.
Thank you. Thank you so much for coming. So listen, the topic of the day, which is, as usual, vaccine. Get the shot or not get the shot. To shot or not to shot. So I have to come directly from you, and what say you?
Absolutely. And you ask me, I will say absolutely you need to get the shot. They say, well, doctor, I have allergies. I say, get the shot.
Okay.
They say, I just don't do well with vaccines. I say, get the shot.
Get the shot.
Because we're challenging this virus versus the vaccine. And the vaccine has already proven that it has not harmed anyone in any way. But the virus, on the other hand, has killed over 500,000 people in America.
500,000.
Some 18,000 Georgians.
My Lord.
Yes.
So we have a real reason, though.
Very good reason to take the vaccine, and
yes.
The studies were very well done, and we can talk about those studies. And people have questions such as the quickness of the vaccine coming to market.
Okay.
Some people have it mixed up with the substance that the vaccine may be wrapped in, the polyethylene glycol. They say that sounds like antifreeze, but
Exactly.
That is not true.
Good.
Some people talk about the possibility of the vaccine being a tracer, some kind of way the government is placing a tracer on you.
Dr. Young.
I've heard it.
That the vaccine
that
is a fluid tracer.
It's one way in which the government will be able to trace you in the future.
God.
I've heard this now, so I don't want to put that out there. It is not true.
But that's what you've heard.
And you've heard things such as the vaccine could possibly turn you into a zombie.
My God.
That the vaccine could change your genetic code. All types of things, and it's just conspiracy theories more so than anything else.
Absolutely. Well, listen, I have to tell you, my neurologist up in Atlanta, who treats my multiple sclerosis, back in January, he said, listen, I don't know how you feel about vaccines, but I want you to know you need to get it.
Absolutely.
And I was really, I wasn't concerned about it. My desire was to get the vaccine. So I was like, great, I will definitely always get the flu vaccines, and any other vaccine that I know would protect me. And I've lost several friends, Dr. Young, by this coronavirus 19. And I'm saying to you, being that it has been approved and is on the market, I don't see any reason why we should not get the vaccine. So as I mentioned, we went ahead right away, and it's so funny how I got it, because of course the first opening was 65 and older.
Right.
And obviously,
yeah, there were inroads.
Obviously, I'm not 65.
No.
No, right?
No.
But the thing was, I was taking my mom, and of course, there were a protocol. You had paperwork to fill out and sign at the initial registration. So in line, I'm filling out the paperwork, and the representative said, "Oh, so you're here for your vaccine?" And I said, "I wish," and I continued to fill out the paperwork. And she says, "Well, you're her caregiver." I said, "This is for my mom." And she says, "So you're her caregiver, right?" And I said, "I am." She says, "Well, go ahead and here, I have some for you to fill out for yours." And I was just delighted. Truthfully, I was thinking she was just trying to hook me up.
Yeah.
Because I was nervous. I was like, shh, be quiet. I won't tell anybody. Yeah. But later I learned that was one of the things that the government was making available. For those who are caregivers, they are available. You can get that virus vaccine. So my mom did get the vaccine, and I did too. Both of us received the Moderna.
Yes.
Now, there are two different ones initially that was brought on the scene,
right.
Moderna and Pfizer. Now, can you tell us a little bit, if any, about the differences in those two?
Yeah, there are more similarities than differences.
Okay.
Because both of them messenger RNA vaccines, and this means that they actually do not have any of the virus in it, none of the coronavirus.
So this is not a live virus.
It doesn't have any other virus in it, like
Good.
the Johnson & Johnson does use a virus vector, but this has no virus particles at all.
Good.
It only wrapped in a lipid core, a fatty-like core, so it can penetrate inside of the cell. So it has to have this little fatty core in order to get inside the cell.
To do that. Good.
And then it's wrapped again in the polyethylene glycol.
Okay.
And that's where people get this polyethylene glycol thing from.
Very good.
And that allows where the injection occurs, these muscle cells, and that's what really makes the pieces of the spike protein that actually we use as a way to stimulate our immunity. So this messenger RNA enters the cell. If you have any kind of biological background, it gets down to the ribosomes.
Yes.
And the ribosomes really are the factory. It is the factory within our cells that actually generate proteins.
Correct.
And so the messenger RNA is nothing more than a template that codes for pieces of the spike protein. If you look at the coronavirus, these little spikes sticking off of it,
yes.
That's part of the spike protein. So that is not the entire spike protein, but pieces of the spike protein are generated. And once it's generated inside the cell and finds its way back out of the cell into the circulation, and it doesn't kill the cell, but the messenger RNA does die within the cell.
Wow.
It generates this immune response,
yes.
where our body makes antibodies against it and T memory cells.
Okay.
And that gets the whole process going. Now, with both of these vaccines, there's a two-tier process. You take one vaccine, and then another 3 to 4 weeks, you take the second vaccine. So that first shot gets your immune system up to a certain level. It doesn't completely give you immunity against the virus. It's about 55% immunity with that first shot.
The first shot. Okay.
And then that 3 to 4 weeks later, when you get that second shot, it takes it up to 90%, 95% immunity after 2 weeks. Okay.
Incredible.
95% after 2 weeks.
Okay.
And in the studies, it basically showed those individuals who did get the virus, that 5% or so. I think it's one person that did get it. They did survive.
Wow.
Okay. And it proved that we can have something like these two vaccines come to the market very quickly.
Yes.
And give us some immunity during this pandemic. And this is perfect type of vaccine for a pandemic, something that you can bring to the market very quickly.
Yes.
And everybody has questions about how it got to the market very quickly, and there's a story about that as well.
Well, that's something I want to talk about as well because, in truth be told, any of the other vaccines, I have no idea how quick or how long it took for them to get to the market and be approved before use. So I wasn't troubled about that. My question is, you mentioned the second tier. Initially, I did receive the first injection.
Right.
And the funny thing was, I treated this arm like it was gold. I didn't move it. It was paralyzed. I treated it as if it was paralyzed. And when I tell you it was so sore that next day, it hurt. It was so sore. And someone told me, well, you did use that arm. You did, flex it and do. I said, no. I was protecting it. This was my protection. They said, well, when you get your next shot, make certain that you use the arm. Don't pet it like that. And so the second shot, it was not as sore as the first, but I did get a response. I did feel a little fluish, so to speak, but nothing as severe as the coronavirus would have been.
Right.
So I was thinking of it more like typically when I get my flu shot sometime.
And if you feel that means that you're getting that inflammatory reaction and your vaccine is working.
Yes.
Okay. So
that's
if you
what
feel
I was
that,
so,
you say, "Thank you, Jesus."
Thank you, Jesus. That's what listen, I was like, I really got it. It
Yeah.
was not
Yeah.
it wasn't a fluke. It was a real deal.
That's what the vaccines are designed to do.
Good.
To generate an inflammatory reaction.
Okay.
Make antibodies and get your T cell immunity up and basically get you ready for what may be coming.
What may come.
That coronavirus. So if you're feeling that, that's what it's supposed to do.
And that was a
and
good
it
thing.
usually lasts maybe 1 or 2 days at the most, and it goes
Exactly.
away.
It really
Yeah.
did. I think 1 day and a half or so.
Yeah.
And I was fine.
Absolutely.
And so what you're saying then, I'm happy to hear that then. So
Mm-hmm.
now that means I'm actually more protected. It's
You
saying
had-
that
you
my
had
body.
right. You had the appropriate inflammatory reaction to
Good.
receiving the vaccine.
Yay. Thank you, Doc.
Mm-hmm.
I'm happy to hear that. Well, listen, I mean, the fact is we have to get this vaccine.
Yeah.
And I feel good because, I mean, my mother is an elder. And then, of course, my father-in-law, and then I'm around people will and hope to get to see my grandchildren and my family and friends. But there are decisions we have to make as an individual for the community, for the better good. And so I know I've heard some things, as you mentioned some of those others. You know what happened in Tuskegee.
Mm-hmm.
Well, we can't mention that, but because I can understand that was a concern because of what happened in Tuskegee was devastating.
Mm-hmm.
However, because of that situation that happened in that experiment, there's so much good that has come out of that.
Yeah, there is not a black coronavirus vaccine and a white coronavirus
Thank
vaccine.
you.
When you go in there and you see all the people in line, you see people of every ethnic group there. So
Absolutely.
if they were just after black folks, they'll have to say, well, we're going to have a black group over here,
Right.
and the white group over here. We're going to get the black group the
This
bad
one.
vaccine, and the white people the good vaccine. But
Excellent.
But that is not what's happening. It is
Very
something
good.
that is ubiquitous to all races.
Yes.
And it's showing that we can work together if everybody actually got the vaccine like they should. At least if 60% got it,
At least
we
60.
could achieve what we call herd immunity.
Okay.
That's community immunity. That means community immunity.
Immunity. Yes, I understand.
which basically saying that the virus doesn't have a vector to actually grow in because so many people are immune against it.
Good.
The virus eventually would peter out. Even though
What?
those people did not, even those 40% of people didn't get it,
Okay.
the virus wouldn't have a place to go.
Won't have
And
a host. So
won't
then
have a
it'll
host.
just evaporate away.
Right.
As someone
it will
once said,
slowly
it'll
go away.
disappear.
And so you can't do that with this virus in the sense of what President Trump wanted. He said, just let everybody get it, and they will achieve achieve this immunity, this herd immunity,
No,
because this vaccine has a very high death rate as compared to
No,
other.
this disease.
It's a virus,
This
right? It
virus.
has very high death rate as compared to so many other viruses.
Absolutely.
Like the death rate for flu every year is
on.
about 1%.
Okay.
The death rate for the coronavirus is 4%, four times that amount.
4%, Dr.
Right.
Young.
So we would just see people dying
Wow.
on the way to getting herd immunity. So
Mercy.
it'll happen, but you lose a large swath of the population in the process. So you just can't do it that way. We'll have to have the vaccine to get as many people as willing to take it.
Good.
And it's not so much that we can force anybody, but
Sure.
the people who are willing to take it,
Good.
to take it. And I think we can get 67% of the population to take it.
Excellent.
We can't get 30 or 40% to take it, fine.
What did
But
you
if
say
we-
about those
if we can
30
get
to
up to
40%?
Well, people have their choice, and
Okay.
it's unfortunate. And the thing that they're missing is that once we get our vaccine, if I get my vaccine and you get your vaccine,
Right.
we're only wearing masks to try to help to protect them from possibly us spreading asymptomatic disease.
Correct.
And so they'll have to continue to wear a mask for a period of time in order to reduce that possibility of getting the virus themselves.
Okay. You said they will have to wear masks.
They'll have to wear a mask for a period of time until the herd immunity is achieved.
Okay.
So they'll just have to continue to wear the mask because they'll always be at risk of getting the virus and potentially dying from it.
Mercy.
And those who've gotten the vaccine, the less and less likelihood of getting the virus, and even less likelihood of dying from it.
Being
Very low chance.
hospitalized or even
Right.
dying.
So they'll still be at great risk. So, it's going to come down to pastors saying, if you haven't gotten the vaccine, please don't come. It's going to come down to airlines saying if you haven't gotten the vaccine, please don't ride.
Correct.
So at some point in time, we'll have to do that until we have achieved herd immunity. We have to get to the herd immunity.
We have to do that. Well, we know we've heard a number of things. I go around sometimes back and forth to the doctor or even to the grocery store, and I'm noticing a large population not wearing masks.
Yeah.
So what will we find as a result of masks not wearing, people not wearing the mask?
Yeah, I mean, what happens, of course, is that they could still get the virus, of course, and they could still spread the virus.
Okay.
So that just showing that they don't have that empathy for their fellow man.
My Lord.
And that's all it really means. And they are blessed that they have not gotten the virus.
Simple.
And died from it.
Okay.
Now, some of them may have already had the virus. It could have been asymptomatic. They could even have antibodies against it. But what we've learned about these antibodies from the virus is that they may last 3 months.
Okay.
And then they begin to decrease and your risk goes up again. And there's been individuals who've had the virus and then got it a second time. So that does happen. So that those antibodies that you get from being infected by the virus just won't last forever.
It will not.
Yeah.
So there is possibility, though, to be reinfected.
Absolutely. It is. After 3 months, your chances increase again of being reinfected, even though you've been infected one time. So
will increase.
Some ask me, well, I've had the virus. Do I really need the vaccine? I say, absolutely.
Absolutely. You really.
But right now, and we really don't know how long this vaccine will protect us.
That's the question I had.
We really don't know. And it's just a study in progress. It's so much a study in progress.
Sure.
We just don't know.
I mean, as I mentioned, it was novel. It's novel virus. So
we may need a booster at some point.
We've heard that mentioned as well. But right now, for this time, 1 year in, we have received the current total protection in terms of our vaccine. And our plea is for all of our friends to please, when it becomes available to you, get vaccinated. This is something that you're going to do not only to protect yourself from not only getting infected with this disease, but then from the sickness that comes from it. Hospitalization, but then death. Death can and likely will occur when your body can't tolerate this virus. So my desire is to reach as many of my friends and all of you to let you know, not only this vaccine is safe, it is effective.
Very effective.
And it's going to benefit us all if we all take a look at it, or most of us, and make a decision today to go ahead and get vaccinated. Now, we've heard about there's several different vaccines now that I understand. There's a Johnson & Johnson that was initially told that it was not listed as effective in terms of the effective rates, but it is only one injection.
Yeah.
And so tell me, what is your thoughts about that? Because I've talked to one of my friends that has received the Johnson & Johnson. Yeah. So talk to our friends about that.
Yeah, you really cannot compare the studies between the Moderna and Pfizer vaccine with that of Johnson & Johnson, because Johnson & Johnson came out later as the variant viruses came out. The ones from South Africa and Brazil.
Very good,
and their studies included individuals who had the variants. And it showed efficacy even in that group. Okay. It's only now that the Moderna and Pfizer are doing those type of studies with the variant. So you really can't compare those two, number one.
I see.
It had like a 55% effective rate after 7 days.
Okay.
And then after 29 days, 1 month later, you achieved 85% protection.
Wow.
And 100% no possibility of no one in that study, 100% did not go to the hospital. So no hospitalization.
That's a blessing.
Right. So it's a powerful vaccine, and it also protects against the variants that are already out there. And we're only learning now. And they with the Johnson & Johnson, they started their study with 18-year-old and up. So it's just for people 18 and older.
Okay, I see.
Whereas the Moderna and the Pfizer studies were done with 16 years of age and up.
Oh,
I
I
see. They're now doing the pregnant women studies, as well as the infant studies, as well as the children less than 16 studies.
Oh, that's impressive.
So all this is happening in real time. But the same degree of complications or whatever you call types of
side effects
or things that could happen after you get the vaccine is still there with all three of these vaccines.
Okay.
You can get a little fever.
Sure.
You can get some degree of aches and pains.
Right.
But none of these studies showed that the vaccine caused death in anyone. I know with the AstraZeneca vaccine that is in Europe right now, they had to hold it for a period of time because they saw some increase in clots. People were actually having clots. And so they after some studies, they just came out with that information there. And I haven't seen the hard copy that it is really not associated with the vaccine.
That's what I read.
But, that's going to be hard to convince people.
Sure.
So they're going to have a hard time trying to move forward with that vaccine. But of the Moderna, the Johnson & Johnson, and the Pfizer, there were no vaccine deaths associated with it.
And that is really what we're looking for, Dr. Young. And I believe, is it true that with any type of medication, new medications, as you can read on the bottles or on the box, it'll tell you these different side effects, possible side effects.
Right.
Is it true, though, that whenever something happens in these studies, that each of these particular participants are required to report, or they're reporting different happenings? So they have to take a look at that and list it until it's determined that it is not a direct relation or correlation of that drug.
Yeah, they have to. Now, the most powerful studies that we have developed in the West are the double-blind, placebo, randomized studies. So that means that you have somebody over here who you really don't know whether they're getting the vaccine. So the researcher doesn't know who has gotten the vaccine.
Actual vaccine.
And they're looking at this person, and they're seeing what kind of problems they have in relation to whatever they received.
Okay.
The patient doesn't know what they've received.
So don't know if they got the placebo or not.
That's right.
Okay.
And it's completely random. They just chose people accordingly.
Sure.
And that gives you a much better study. And all these studies were randomized, double-blind, placebo, and controlled.
Excellent.
So that means that you get some information, not what I heard information, but what the science truly shows.
And listen, we've heard all about science. I mean, let's look at the science. And so we have to know a lot of things are based, truth is based on science. And we're looking at this particular pandemic and this virus that has not just spread in our state or in this country. It is a worldwide virus. Yeah. And so my question for you, Dr. Young, what is your thoughts? Do you believe that this virus in some form may continue on for years to come? Or do you think it may be like the flu, it's seasonal, come back every year? Or do you think this is something that we may we don't know? What's your thoughts about that?
Yeah, I think it will be here in some form. Coronaviruses have always been around. That's what causes a lot of our colds.
That's correct.
So it's not like it's a new virus from that standpoint. It's just new to us in the sense that we've never been exposed to this coronavirus.
This particular one.
So I think it may be around, but it'd be a milder disease.
Okay.
As people develop more antibodies against it, you may still get something, but it's just going to be almost like getting a bad virus, but not necessarily the flu.
Okay.
But you may still get something.
And experience some type of symptoms.
Right, but in terms of hospitalizations and people going on ventilators and dying from it, I don't think it's going to be around in that form.
Well, I just want to go back and ask you, Dr. Young, when this first happened, when did you first become aware that there was a virus that's gone wild, so to speak? When was it that you first noticed?
I think in January we heard something, but we didn't know what it was, and we just, everybody was talking it down. The president was talking it down. It really wasn't until after that February 28th when I think the president was on TV and he was basically saying it was all a hoax.
Yes.
And it was that same day that individuals went to the funeral here in Albany, and that same weekend that the marathon also happened. And it was shortly after that it hit everybody that we have a problem. So it really that first week in March that we really knew we had a problem. We actually had church on that first Sunday in March. Wow. And some people didn't come because they already had gotten the message. And I didn't come. I didn't go. Okay. I saw church on Facebook.
I see.
Live. And then we canceled church that second Sunday onward.
What did you hear, though? What were you hearing that
Well,
first week?
that first week we were just hearing that people not only were getting sick, but they were dying. They were going to the hospital in large numbers.
Wow.
And that we basically have something that we don't know what it is and don't know how to contain it.
Gotcha.
Not even at that time were we wearing masks.
Wow.
Okay. So the first patient I saw that died from it was a 42-year-old. And she came to see me with her little son with flu-like symptoms.
Mercy.
And I was in the room with her without a mask. She didn't have a mask. And we were just discussing, and I gave her some medication. And then she called us back and said she had some problems with her stools, and she was having some black stools. And we thought it was really that she was bleeding inside. So said, come back and let us make sure that's not the case. And she couldn't hardly get to the back because of shortness of breath. And that's when we realized that this is one of those cases.
One of those cases.
And we called EMS, got her to the hospital, and that was a Wednesday, and she was dead by Saturday.
Dr. Young.
And it took them a while to actually confirm that it was positive. And that means we all had to quarantine. Yep, surely. We all had to quarantine. It was the first time I quarantined. I had to quarantine about 4 times. And
4 times because of your exposure to patients with it. Wow, Dr. Young.
But God was so good that I did not ever get the virus.
Praise God.
Yeah, and I've tested myself with antibodies, and that means I did not even have a asymptomatic case. So
good.
That's been very good. But in the beginning days, we did not know to wear a mask, and they didn't know the utility of mask, and nobody had a mask. Who had a mask sitting around their house?
No one had a mask. Not around the house. Come on. Yeah. So, maybe, cutting the yard or something. You have allergies, but that is something. And can you tell me then finally, well, not finally, but in addition, how are we getting infected? What do you believe is the manner by which we can be infected with this virus?
Yeah, I mean it's an airborne virus, so it does not do well sitting on surfaces. Okay. So you're not going to get it from rubbing on a countertop or even sitting on a commode or anything. But it's an airborne virus that if you sneeze directly in someone's face and you have the virus, they'll definitely get it.
And even talking.
And talking, right. And lately we've had this, the level of which you must be separated. Sure. It has been, like the research is showing us that 6 feet may be a little bit too far, that we can even get away with just being 3 feet.
3 feet, that's what I've seen.
So, but I think it's just respiratory borne, and, we even saw less flu this year. Because people were wearing masks. And so that says, wait a minute, do we really need the flu shot if everybody wear a mask during the fall?
Maybe not.
but people are not going to wear masks. They just are not going to do it. But we did not see many cases of flu. Matter of fact, I didn't see a single case of flu.
Praise God.
So that was phenomenal. It's not because people took the flu vaccine either, just that they were wearing masks. Right.
Well, listen, I'm so happy that you've come and shared this information, because we too share that whole message that vaccines work, and we love the one day soon, prayerfully, that we can get to the day that we have herd immunity. So what would you say to our listeners today, if you could say one thing to our listeners about the vaccine?
Yeah, well, the vaccines are safe, efficacious, and we hope long-lasting. We're asking you to please consider taking a vaccine at all costs. There is no money associated with it. No one is going to ask you for your billfold. They may ask you for your insurance at the pharmacy, and that's only because they're trying to collect a administration fee. And if they don't get the administration fee, they still cannot charge you. So it's a free vaccine to all of us. So. And sometimes with something free, people get a bit afraid about it. But I'm just happy that we have something now that could potentially give us protection against this coronavirus. And even in the future, give us a chance to see our grandchildren again. Yes. And see our children again. I haven't seen one of my grandchildren. She was born November of 2019, and we saw her once in January and hadn't seen her since. My Lord. So I would love to see my grandchildren again. Yes. So as soon as we are vaccinated, my wife and I and my mother-in-law, we are headed to Valdosta to see Sophia.
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 Amen. Well, listen, I tell you, I can imagine the desire. And there's so many of our friends that's not seen family and friends. So this really matters. And it's not for one particular race. It's for us all. Let's join together and make this change today. Get your vaccine as soon as you can.
Absolutely.
Thank you, Dr. Young.
Thank you.
We'll see you next week.
You've been listening to Chosen to Conquer. Chosen to Conquer Incorporated is committed to empowering, educating, and assisting individuals with the devastating effects following the diagnosis. Listen to Chosen to Conquer every Saturday beginning at 4. Also, for more information on Chosen to Conquer, go to chosentoconquer.org. Listen to Chosen to Conquer every Saturday at 4 o'clock on WZBN, Praise 105.5 FM.